Welcome to the Medovia Menopause Podcast, your trusted source for information about menopause and midlife. Join us each episode as we have great conversations with great people. Tune in and enjoy the show. Hey everyone, this is actually a webinar replay that we recorded on Menstrual Hygiene Day with Dr. Dombo with Alloy Health. It's such a great conversation. We wanted to share it with our podcast audience, so we hope that you enjoy this replay. Let's go ahead and get started so that we can finish up at the top of the hour. I do want to start off by just saying welcome and happy Menstrual Hygiene Day. Today is Menstrual Hygiene Day, and for those of you that are not familiar with 528, Menstrual Hygiene Day was chosen because we menstruate on average for 5 days every month, every 28 days. So 528 is Menstrual Hygiene Day. I spent significant amount of time in the menstrual health space prior to moving and shifting into the menopause space. So this is a day that is very near and dear to my heart. It's a very important topic, and we are absolutely thrilled to have Dr. Dombo with Alloy Health with us here today. Thank you so much, Dr. Dombo, for joining us. You are a prescribing OB-GYN with Alloy Health. And I'm wondering if we can start off by you giving us a little bit of your history and telling us why this is so close to your heart.
Yeah. So I am a board certified OB-GYN. And first of all, thank you, April, for having me. And I am honored to be able to just really break down, all the different things around menstrual health and what that looks like. Because education is so important and where I think it all starts. So I'm an OB-GYN board certified, and I've been in practice for 20 years. And I'm also a Menopause Society certified practitioner. I have had the opportunity to practice not only here in the United States for majority of my career, but I've also had the opportunity to work in other countries like Cambodia, Sri Lanka, El Salvador, did some volunteering in Haiti. So I have this cross-cultural perspective when it comes to the way that women relate, to our periods, pregnancy, postpartum, and then life after, including, the menopausal transition. And why this is so near and dear to my heart is that we are not, like, across the board, we are not taught, about what is normal. And I think I see this even in other cultures. There's certain aspects where, you have your period, but not really knowing what's a normal baseline. And women tend to either ignore, symptoms or experiences that they have and think that this is normal. I know in a lot of developing countries, women, some of the girls may stay home, when they're on their period and they don't go to school because they just do not have the hygiene products, to be able to manage that. And they're not, adequate toilets or, areas where they can actually navigate having their period, in public. So I truly love being able to educate and being able to talk about this because it's just a huge part of our lives as women that we may not necessarily know what is normal and what should we possibly, bring to our doctors. And I would love to be able to, to talk about it and normalize that conversation.
Yeah, I love that. You brought up so many good points here. And I think the same holds true, not just in developing countries, but here in the US and developing countries as well. We are as young ladies, young girls that are just moving into that pubescent stage, adolescent stage, we don't get that menstrual health education. And really, as we move through different life stages, that doesn't change. It's not like at one point in time, someone says, hey, let's teach you about menstrual health, right? It starts really early or doesn't start early. And then that carries with us, and we're just not having the conversation. And you're right. menstrual health is so important because it crosses many life stages. We menstruate, I think, on average, what, 8,000 days in our lifetime. If we think about that, 8,000 days. And it's something that we are not talking about. And education is so important. We don't know what we don't know until we do, and then we do better. And we can make healthy choices for our overall well-being when we are educated. I'm curious, and let's just set the stage here. Why do you think we're not talking about this, especially in the workplace? And that's where we sit primarily is in the workplace. But why aren't we having this conversation?
Yeah. I think menstrual health, or I believe that menstrual health has historically been dismissed or treated as taboo, right? Even in medicine, gynecologist, we're taught what's normal, but typically, like in general, it's anything around your period is considered taboo. And
Hmm.
I think many women are told that things are normal. And the learned behavior is really just to push through. Okay, I'm just going to push through.
Hmm.
And, you show up to work, you perform, you figure out how to do what you need to do, and yet we still are suffering, through that. And again, just as I mentioned, we do not teach women what a healthy menstrual cycle looks like. There's no baseline for comparison,
Hmm.
the lifespan even. Like, okay, when you're in your 20s, and 30s, or when you're in your teenage years, what's normal? What's normal, in your 40s? And then, what about, when you're in your 50s? So I think, the symptoms that show up when we're at work, like fatigue, pain, brain
Yeah.
fog, certain mood changes, they impact our performance and our overall well-being. And yet I think we're really like conditioned to just let's push through, let's figure out how we can just keep going because this is kind of an inconvenience.
Hmm. Hmm. Yeah, inconvenience and the stigma.
Mhm.
I mean, back to your original point, I think there's still a lot of stigma that holds true with menstruation and menopause. And we could have a whole other webinar and conversation about that, and how we break that stigma in the workplace. But for right now, can you set a foundation for us? I want to walk through how menstrual health evolves over a woman's lifespan. And let me advance the slide here for you. Um,
Yeah.
let's dive in because I know that this particular graph was really important for you to speak to. So can you take us through and what does it look like? What does menstrual health look like, and how does it evolve over the woman's life at different life stages?
Yeah, I want to just take a moment. I want to take a moment to really take a look at this cycle right here because I think
Hmm.
this speaks to exactly what's happening, in our bodies. And, day one being the first day of your period, the first 14 days of your cycle is considered the follicular phase. And that's the phase where, you have a follicle that um, starts to secrete estrogen, and that estrogen level starts to increase by day 14. You've produced a certain amount of estrogen for a certain amount of time, and that's what promotes ovulation. And so we look at ovulation happening around day 14. So that's when your estrogen peaks. And then once you've ovulated, your estrogen starts to fall and your progesterone starts to rise. And that's day 14 to 28 of your cycle. And then again, you have your period around, day 28 into day one. So it's a very cyclical process
Hmm.
when things are working normally. And I think it's important also to know that there are two parts of the brain. Your hypothalamus is the first part, and that will send a message to your pituitary. Your pituitary responds to that message and sends a message to your ovary. And this is how this whole relationship works. And as you can see, you have hormone levels, your FSH and LH are what are produced by the hypothalamus. And I'm sorry, GnRH is produced by the hypothalamus. The pituitary secretes FSH and LH, and FSH and LH act on the ovary, and the ovary produces estrogen and progesterone, and that kind of cycles through this, is considered the menstrual cycle.
Yeah.
And then just to answer your question about, looking at menstrual cycle across the health span, right? Across of our health span.
Mm-hmm.
During your teenage years and your early 20s is, when you consider that you experience what we call menarche. And menarche is when you have your first period. So the first few years after menarche, your cycles tend to be irregular. And this is really normal because that HPO axis, well, I said the hypothalamus, pituitary, and ovarian axis, needs time to mature. As that axis matures, things tend to normalize. During the teenage and 20-year cycle or period, what's not normal is severe pain. Heavy
Mm-hmm.
bleeding, where you're soaking through a pad, or a tampon every hour for several hours. Something like those things need evaluation. So the earlier we identify these issues, the sooner we can determine whether or not there's any intervention that's needed, and then we tend to have better outcomes. So this is why it's important to really identify what is normal and what is not normal during this phase.
Yeah.
And for those who are, during this time who end up on a birth control pill, it's important
Mm-hmm.
to understand that birth control pills can mask symptoms like, PMDD, which we'll talk about a little bit more, or endometriosis. So I think it's really important to identify that, you know,
I appreciate that. And I'm wondering, this might be a good place to ask, um, are there racial and ethnic disparities in menstrual health? Does this look different depending on race and ethnic background?
So, what I would say to how to answer that question, when we look at, especially Black women, they're disproportionately affected by things like endometriosis, fibroids, the diagnosis of PMDD,
Hmm.
those kinds of things. And I think those tend to show up, more in your late 20s and your 30s. So, when we jump into that phase of the 20s and 30s, that's when we look at cycles being more predictable, right? And we know that things like stress, relationship and education demands or career demands, relationship changes, pregnancy, postpartum, things like that can impact, your cycle. But I think that is when we start to identify in your late 20s and 30s, we start to identify things like fibroids, endometriosis, thyroid issues. That's when they become prominent. And I
Mm.
think when we start to think about fibroids, Black women are disproportionately affected, by fibroids and endometriosis. And I think PMDD, PMS, PMDD is really much more underdiagnosed in women of color.
Mm.
So it's important to know, okay, if PMDD may show up during this time, fibroids may show up during this time, how do we know? How do we know if what we're going through and what we're experiencing is simply normal, or could it be something else?
Yeah, really important. If we don't know what's normal, we don't know that we're experiencing something that's abnormal, and we should go seek help. So that makes sense. I'm wondering if you can just take a brief minute here to help our listeners and our audience understand what PMDD is, and I'm not sure that everyone is familiar with that. Hi, everyone. I want to jump in here real quick to share a new AI health company that just launched called Natura AI, and I'm loving it. Natura is an AI wellness assistant built specifically to meet you where you are and help guide you through your natural health journey. Whether you're trying to make sense of symptoms, supplements, ingredients, cycle changes, cleaning products, or conflicting wellness advice online, Natura gives you a thoughtful place to start. They have a robust knowledge base of over 100,000 medical and wellness sources, and it's growing every day. Natura is also built with safety and privacy at the center, so your health questions and personal context stay personal to you. You can ask Natura about herbs, supplements, food, wellness routines, family health questions, or even products you're comparing in the grocery store aisle. It helps you understand what may be worth exploring, what the research says, and when something might need a clinician's inquiry. It's not a replacement for medical care, but it can be a really helpful support tool when you want to feel more informed and less overwhelmed. So, whether you're at the doctor's office and you want a second opinion, standing in the store trying to choose between two products, or you're just trying to sort through all the noise around women's health, hormones, cycles, and everyday wellness, Natura AI gives you a calmer, more personalized way to figure out your next step. You can check it out at mynatura.ai. That's mynatura.ai. So try it yourself. Now, back to the show.
Yeah. So I think we've all heard about PMS, right? We all, and PMS, PMDD, the main difference is how the impact on your quality of life. So PMS, we think about mood swings, irritability, bloating, fatigue, breast tenderness, all these happening pretty much the week or two before your cycle occurs, as a result of that rise in progesterone. PMDD are those same symptoms, but amplified and resulting in an impact in your quality of life, where your work is disrupted, your relationships are disrupted, and there is a clear impact on, on your life, on your lifestyle. So it's very treatable, but I think it's important to know that PMDD and PMS are very different in their clinical diagnosis, and one should not be swapped out for the other.
Yeah. Thank you for that clarification. I think it's important. It's important to name that. It's important to understand that. While we're talking about menstrual health issues and challenges, what are some of the more common menstrual health issues that are misunderstood, dismissed, misdiagnosed, or maybe even just normalized?
Yeah. So I think I know heavy bleeding is one of the things. And I see this because I get patients who end up in the emergency room,
Mm,
a blood count of 5, whereas 12 is supposed to be normal. They can't breathe, they're lightheaded, they're dizzy. And when we talk about their periods and how heavy they were, they think, oh, I just thought that this was normal.
mm, mm,
Right? So when you start soaking through a pad every hour or a tampon every hour for multiple hours, that is not normal.
mm.
We start to think about, could this be from a fibroid, a polyp, a clotting disorder, or some hormonal shifts can result in that. So, heavy bleeding is one that I think I see, especially in Black women. They just think, I just thought that this is how my body operated.
Wow.
And it's really important to identify that that is not normal. If you start bleeding for more than 7 days and it lasts 8, 9, 10, 20 days, that is not normal. Another one, debilitating cramps. It's one thing to be able to know that you have cramps with your period, but end up needing to take ibuprofen and they go away. But pain that impacts your daily life and really requires much stronger pain medication, keeps you at home from work or school, that really is not normal. And then go
Yeah,
ahead.
go ahead. No, go ahead.
And
Yeah.
then, I think of things like severe mood changes, right? Like
Yeah.
PMDD that we just talked about, when it starts to really impact your ability to, function at work, to be able to, or, attend school, that, 5 to 8% of women are diagnosed with PMDD. So it's a real phenomenon. But they tend to be misdiagnosed as, oh, it's anxiety or depression.
Right.
you know so and then let's say you're in your 40s, your cycles suddenly start to change significantly. They're shorter, they're longer, or they may be heavier or lighter. When you notice a change in pattern, that's something to start asking questions about, because that could signal something underlying going on in your body, and our body tells us everything we need to know.
So important. And I know we're going to get to perimenopause, menopause, and spend a little bit of time in that perimenopause conversation, because there's so much that happens at that point in our lives, especially with our menstrual cycles, as you just mentioned. But before we move on, I'm wondering if we can do a little quick myth busting moment, if you will. And if you can just kind of share with us maybe two or three things that you hear all the time that you wish people would stop believing. I think that might be important.
Yeah. So, and it's so funny because I keep looking at you in the corner over here.
Yeah.
If my eyes are looking in the corner, it's only because, I'm looking at April. She's not in the middle of my screen. She's up in the corner over there.
It's okay because you know what? This is real life, and this is the reality of webinars and live webinars. I actually can't see you at all because I'm sharing my slides and my screen. So I'm looking at your lovely menstrual follicular phase, luteal phase slide. So whoever, wherever I'm looking, I'm just looking at a slide. I can't even see you. So go ahead. Yeah.
So can you just repeat the question again? Myth bust?
Absolutely. Myth busting, myth busting moment, if you will. I'm just wondering if you can share a couple of myths that you wish that people really we could clear it up that shouldn't be.
Yeah. So I think there tends to be a myth that if you have normal labs and normal imaging studies, that you're fine. Like there's nothing wrong with you. And that's not true necessarily. It may take just a little bit more of a deeper dive into really like unraveling, okay, can we look at the symptoms that you are having and where you are in your cycle? Is there a correlation between the elevations of estradiol or the elevation in progesterone and some of the symptoms that you're experiencing? Normal labs is just the surface,
Mm.
but it doesn't necessarily mean that you're fine. Painful periods are normal. That's another myth.
Mm.
You know, um, like perimenopause is not a disease, right?
Yeah.
That's another,
Yeah.
that like just because it's a natural transition doesn't mean that you have to suffer, right? Because I
Yeah.
hear it all the time, from people like, oh, well, if it's just a natural transition, then, why do you have to do anything about it? But no, you do not have to suffer. They're very, very safe options to help you manage your symptoms, and you deserve a conversation as to what aligns with where you are, what aligns with what what your priorities are. And I think, having those options is important. Another myth, cycles, where your all mood symptoms are just anxiety.
Mm.
They're just anxiety that need to be treated with an antidepressant.
We have a significant percentage of women that are on antidepressants. What is that? What is that percentage? Can you recall right now, Dr. Dombo? I didn't mean to put you on the spot, but a significant portion.
I think it's anywhere between 40 to 60%.
That's what I thought. Yeah.
And I'm not saying antidepressants are bad. I'm not saying that
Mhm.
they're wrong. I think as we talk more about like especially the perimenopausal transition, there's such a delicate balance between the role of estrogen and the neurotransmitters in our brain, like serotonin, dopamine. Like there is such it's very interconnected. And so estrogen tends to have a very stabilizing effect on neurotransmitters, that are in our brain. So when estrogen starts to fluctuate, those neurotransmitters, those feel-good hormones start to bounce around. And so, we can add more, to help with the volume of neurotransmitters, or we can try to stabilize, right? The fluctuations that are occurring. And I want to also make sure that like there's no one right answer, but I think
Mhm.
it involves really teasing apart what exactly, how they can work together.
Mhm. Mhm. Agree. That's why good care is incredibly important. Can I come back to your point about pain and painful periods are just normal and we just need to deal with it?
Mhm.
I think there is definitely a myth that that's the case. But I'm wondering how, as a woman menstruating, how do I know what normal cramps are versus the painful period at the other end of the spectrum where I should go in and see someone?
Right. So typically, ibuprofen, which is an anti-inflammatory, what tends to happen when you have your period, a lot of like cytokines get released, and the anti-inflammatory effects of, ibuprofen tend to be, what really help and do help with that kind of pain.
Okay.
If you find that that is not helping you and you are still in significant amount of
Mm-hmm.
pain and you need more, stronger medication,
Mm-hmm.
that is a signal that, wait a minute, something may not be right here. And so I think it's important to really listen to that. Like if you respond well, then, there is no issue. If you're not taking anything, I always say try at least, a 600 milligram ibuprofen, see if
Yeah.
you get any relief with that.
Okay.
If you get relief, that's wonderful, right? If
Right.
you don't get relief, then, we need to kind of talk about, okay, why is it that you're needing stronger medication?
Right, right.
Could be
You
something.
don't need to suffer. That's
Mhm.
the point, right? And I think it comes back to quality of life. We talked about that with PMDD as well. If it's impacting your quality of life and you're in that much pain, you don't need to suffer and that there are other solutions. So, okay. Well, let's spend some time here in the perimenopause stage, if you will, or conversation, because I think a lot of our audience is probably in this stage of life.
Yeah.
And it's something that we have difficulty navigating. So I'm wondering if you can spend a little bit of time here and talk to us about what perimenopause is, when it starts, and give us a little bit more information and how that affects our menstrual cycle.
Yeah. So again, perimenopause is the transition leading up to menopause. And that can be anywhere from 4 years to 10 years, based on your genetics, your ethnicity. With Black women, it tending to be longer
Hmm.
at the 10-year point, Hispanic women closer to the 9-year point, and Caucasian women, come in, closer to 7 years, but it can be anywhere from that 4 to 10 year, you know, range.
It's a long time, by the way.
And so it
Yeah.
can start in your mid 30s, but more commonly we see it happening in your 40s, especially your mid 40s. And, the average age of menopause in the United States is 51. So your periods don't have to stop, by 51 for you to have begun perimenopause. And I think it's,
Okay.
that's what we're starting to talk more about is that, your period, you can still have regular periods and be in that, you know, state of perimenopause where you're having really bothersome symptoms. And I think it's, well, I know, I shouldn't say I think, I know
Yeah.
it's really important to identify that the time of hormonal fluctuation in perimenopause can be worse. Your symptoms can be worse than postmenopause because
Hmm.
hormones are going up and down and fluctuating, and it's a time of intense volatility.
Hmm. Hmm. Like a
So
roller coaster, right? Those we compare it to a roller coaster with those hormones. Yeah.
it's so volatile that the symptom burden during that time can be pretty significant.
Yeah. And I think we are used to that benchmark of periods, right? When we think of menopause and perimenopause, it comes back to our periods and our flow and our cycle. And are we missing those periods? And are they sporadic? And then when I have missed it for 12 consecutive months, then I'm in menopause and everything's okay. But that's not the case. And there are 34 plus. I'll use just the plus symptoms that are associated with menopause. So women can experience more than just that change in period. Can you help us to understand what some of those other symptoms are in that perimenopause stage that we might be experiencing that might trigger, oh, wait a minute, I might be in this perimenopause stage?
Yeah. So some of the early signs, and I'll start with, some of the earliest signs, are sleep changes. You may notice some subtle changes in your sleep where you're having difficulty falling asleep. You wake up in the middle of the night and you can't fall back asleep, or you start noticing that you wake up before your alarm clock goes up and you can't go back to sleep. So those sleep disruptions can start to occur in the beginning. You can also start to notice some shifts in your mood.
Mhm.
We talked about, irritability, anxiety, depression. Those are all interconnected with again, that stabilizing effect that estrogen has on those neurotransmitters in the brain. So, that can occur. And again, brain fog, which is a lot of memory
Mhm.
issues where you can't remember the name of a word. You can't remember where you left your keys. You can't remember, where you left your pair of shoes. You can't remember that you left your purse at the restaurant.
Mhm.
So I guess what I'm trying to say is, these can occur, and a lot of times you can start thinking, oh my gosh, it's just that I'm getting old.
Right.
But there's actually something biochemically going on in your body. Um, and that's why that cycle, it's really important to remember that menstrual cycle, like when things are thrown off, your body really responds to the impact of that. The subtle changes in your cycle, like I
Mhm.
mentioned, like, you may notice that, man, I was every 28 days, now every 21 days. That's a change for me. Or you may notice that, wow, I'm now every 35 days instead of every 28 days. Or you may notice again that my periods have just started gotten heavier. The late number of days I'm bleeding is longer, or it may be lighter. So many different changes that can occur, but you'll notice a baseline change. You could notice a baseline change in your periods. And
Mhm.
I think you start noticing changes in your sex drive.
Yeah.
Oh, vaginal dryness, it's just harder for you to get lubricated during
Yeah.
intercourse. You feel drier.
Mhm.
Notice that you're having changes in your bladder function where you could hold your pee easily and get to the bathroom. But now it's like,
Mhm.
whoa,
I gotta go. Yeah.
at the moment you notice you have to pee, if you don't get to a bathroom and
Yeah.
you leak, or you may notice that you're having recurrent urinary tract infections. It's just the muscle in your bladder either becomes weaker as a result of just that reduced amount of estrogen, or the fluctuating, estrogen has an impact on the tissue, and your bladder function is starts to change. These
Yeah.
are all signs, that, this could be perimenopause.
Yeah. And really good to know. What do you wish that women knew before they entered the perimenopause stage? What's important for us to know going into this, getting ready to enter, right?
I would say, like, I would 100% say you are not broken,
Mm-hmm.
because I had no idea, and I thought I was broken.
Mm,
I was aging. I thought that this is what it meant to get old.
mm.
And you know what? You have to adapt your environment to match that, right? You can't
Wow.
stop anymore because you're just so tired. Like,
Mm,
there are treatable ways to navigate this transition. And
yeah.
it's a time that you really can embrace the shift
Mm-hmm.
versus resist the shift. So that's what I would tell, every woman. And I would also tell every woman, um, start learning the things that you enjoy when it comes to moving your body, because
Mm-hmm.
your body now is something that's not just an option, but
Optional. Yeah. Yeah.
what kinds of ways to move your body do you enjoy? And then
Yeah.
just remembering that, muscle is one of the most important organs during this stage, because
Yeah.
that's what's going to really help your metabolic health. So, and nutrition.
Yeah. Yeah. It's the lifestyle changes
Yeah,
that you're talking about, right? I mean, there's a lot of conversation about hormone therapy, but really lifestyle is just as important as anything that we're taking, right? Or putting on our body. And I love that you just brought up movement. Find what you like to do for movement, because I also think that there's a lot of pressure on women in that menopausal, postmenopausal stage, and lift hard, lift heavy,
yeah,
right? Do
yeah,
your hit sit workouts, and it's like really move your body. What do you enjoy doing,
yeah,
right?
yeah.
Um,
And bring other people along with you,
yeah,
Like,
yeah.
I have this place that I love to hike. And
Mm,
so I just, like, now I'll send people pictures and they're like, oh my gosh, that's so pretty. I'd love to hike with you. Okay, let's do it.
yeah,
Let's figure
yeah,
out a day. Because I think, it doesn't have to be something that you navigate alone.
yeah,
And it can be fun, to start doing it with other people. So I think that's important. I mean, yeah, we see the standard.
yeah, yeah, yeah. And that's important. I don't want to dismiss that at all. Yeah.
But I think like, let's just get back to basics, right? Joy, community, like those are equally important as, okay, the lift heavy, right? We don't want to lift
Mhm.
heavy at the expense of all the other things because I think
Right.
that's where it can become detrimental to our mental health because
Hmm.
then we look at something that seems unachievable. If we don't,
Yeah.
you know, do resistance exercise like 4 times a week or 3 times a week, along with this and eating our protein, it becomes a standard that we feel like we won't ever meet up to.
Achieve. Right. I can't do it. Right.
Do
Right.
it. And that's not what this is meant to
It's a
be.
terrible feeling.
Life.
Right.
Like this is life. Let's enjoy it. And let's do the things that we know we can have goals, but it's not the end of the world if you don't get to that point, but you're doing something, you're moving your body in some way.
Mhm. You're doing something, you're finding joy. Thank you for taking the pressure off all of us, Dr. Dombo. You mentioned mental health. So I want to ask the question, is there a correlation between menstrual health, hormone health, mental health? And if so, can you talk to us a little bit about that?
Yes. So there is a definite direct correlation between, our menstrual health, our hormonal health, and our mental health. And it's really important that this is something we all understand because it can be very isolating if you do
Mm.
not know the connection, right? And
Yeah.
I think I mentioned it before already, but like when you start to feel bad and you start not to feel like yourself, it's easy to question what is
Mm.
wrong with me? Like as
Mhm.
women, I think as
Right, right. Hmm.
we tend to think, what is wrong with me? Why can't I, like why am I, unhappy or why am I miserable or why do I just feel mad? The
Yeah.
things that used to bring me joy, don't bring me joy anymore. And it is important, especially in your 40s to identify that like the estrogen and progesterone are deeply connected to the neurotransmitter systems in our brain. So as I
Yeah.
mentioned, serotonin, dopamine, GABA, those are all neurotransmitters
Mm.
that are in our brains. And when estrogen levels fluctuate, whether it's before your cycle, postpartum, and
Yeah.
perimenopause,
Mm.
your mood, your cognition, your emotional regulation are all affected.
Yeah.
So this is a biochemical issue. It's not a you're not good enough issue or just get it together issue or push yourself harder.
You're going crazy, so just deal with it, right? So
Yeah.
that's how we
Push yourself
feel,
harder.
though, right? I mean, that is how we feel. And
Yeah.
it's important to understand that we're not going crazy. We're not
Right.
going crazy. There is something happening in our brain, in our body. Every part of our body is affected when our hormones are um, I don't want to say out of balance because we don't really balance our hormones, but when they're very right, we move into those life stages.
Yeah. And I think it's important to also identify, just as you said, so for example, severe dry eye, right?
Hmm.
Like who who knew that that was something that came with perimenopause, right? I
Right.
ended up in an emergency room, but that is something that I tell my patients, when we don't know, it can be very isolating. It can be
Right.
depressing. It can be like that is another aspect, right, of the mood, the impact on your mood, certain things that are changing in your body that you have no control of
Yeah.
or little control because
Right.
now know now that when you're educated you're like, oh, okay, this is what it is. There's a little more power that you
Mm.
can have. There's a little
Yeah.
bit more hope. There's a little bit more optimism that, okay, this is just something that is normal. We get to normalize that, and I think that in and of itself for our mood is huge.
Yeah. And the education helps us to advocate for ourselves. We know what questions to ask, right? I sit in this space, and you talked about dry eyes. It just reminded me that I have extremely dry eyes, and the connection wasn't even made for me, who marinates in this every single day. And I fortunately had an eye doctor that's not my normal eye doctor that said, hey, your eyes are dry, could be hormones. And we went into this whole conversation. I thought, oh my gosh, I finally have relief for my dry eyes. But again, I didn't know. So I think the education is really important so that we can advocate for ourselves and we know what questions to ask our physicians
Right.
and have that conversation.
And April, it's really important. And I want everybody to know that, remember, these symptoms are happening all over our bodies. And there isn't one doctor necessarily who you go to who will put all the pieces
Everything. Yeah. Yeah.
maybe shuttled over here for this, shuttled over there for that, shuttled over here for this. And
Yeah.
obviously, the impact of the WHI on women's health,
Hmm.
we've taken a hit to, being able to know more and educate women more. So
Yeah.
now we're doing that.
Hmm.
That's why it's
Hmm.
important, because your doctors may not necessarily put all the pieces together and realize, oh, all these different
That's
things
right.
are the results of one thing.
That's right. We're learning. You're learning as a physician. Everyone's learning and growing, right? We're in this together and we're all learning. So, yeah, thank you for that. I want to make sure that we leave everyone with practical steps, things that they can do to advocate for themselves. So, if we have people that are listening, watching, that might find themselves in the perimenopause stage or they're having challenges with their menstrual cycle, what are some things that they can do? What are some practical steps?
I always tell patients to track your cycle over 3 months. Okay. Um, Patterns become visible. Um,
Mm,
your period dates, your symptoms, are they happening in that first 14 days that we saw? Are they happening more pronounced in the 14 to 28 day, part of your cycle? If you can if you can track symptoms and cycle over 3 months, you can see patterns, and then the doctor who you talk to will see the patterns a lot more clearly. And being very specific and naming your symptoms is really important in terms of the way that whoever you see will respond. Because as doctors, we look for patterns. That's how we're
mm,
able to know, okay, if something's happening reoccurringly, there's
yeah.
obviously something underlying, and we can kind of shape, okay, and come up with a better diagnosis. Because
Hmm.
yeah, it's your body, right?
Yeah, we know it. We know our bodies, right?
And
Hmm.
we're just here trying to piece
Mm,
together what's going on with you. So really being able to have that clarity,
mm,
and seeing if there are patterns that are happening. And then again, when instead of going in and saying, I'm not sleeping well, I am waking up at 3 a.m. 4 times a week for 2 months.
hmm. Be specific. Yeah.
Be very specific, because that
Mm,
is very different than, oh, I'm just not sleeping well.
mm,
You know what I
hmm.
mean? And so when a doctor hears that, they're like, oh, okay, wow. They get to see not only the impact, how often it's
Yeah.
occurring, and how it's impacting the quality of your life.
Yeah, it's so important. And I'm thinking about the heavy periods and their irregular periods and how specific we can actually drill down and bring that information to our physician as well. I mean, you fill in the blank with the symptom, but just be specific. We tell people that all the time during our training sessions. And it's nice that you broke that down to give specific examples because I think sometimes when we say be specific, we don't understand what that means either. Right.
Yeah. I mean,
So,
I think from the doctor's end, right? Because I've been
mhm,
in different cultural environments where cultural norms will be like, I can't sleep, or I'm not sleeping well, but it doesn't help me pinpoint where
mhm,
the exact problem is,
mhm.
because that could mean anything.
Right. Right. And I think sometimes we feel like we're bothering the physician. Like, I don't want to be a pain in the drain. I don't want to ask too many questions. I want to be nice. I don't want to take too much of their time. But really, what you're saying is please do.
Yeah. At the
Yeah.
end of the day, what will happen is majority of the time that you're face to face with the doctor, they're going to be having to drill and dig, and majority of the time is going to be spent trying to get and pull out that
Yeah.
information from you so that they can try to figure out, okay, is there a pattern? Is there not a pattern? If
Yeah.
you can't put together a pattern, they're just going to be like, oh, it's easier for them to be like, yeah, this may not even be a real problem.
Right.
You
Right.
can go with, you know, accelerating that process for them,
Mm-hmm.
the chances of you having more time to actually discuss the treatment
Yeah. Yeah.
options, right?
Right.
You'll have more time to do that.
Yeah.
Because again, history gives us 80% of the diagnoses. We
Yeah.
get it from just what you tell us.
Yeah.
So if
Better
it,
prep, better
yeah.
outcome.
So if
Yeah.
it takes the doctor like 15 minutes to pull out all that information, you're
Yeah.
missing out on the opportunity for that time to be used to really be like, oh, let's talk about what we could actually do to improve
Yeah.
because this is what it looks like it could be, right?
So
A lot of
important.
times you'll be like,
Yeah.
hey, well, it could be this, it could be that. The doctor's like, well, let's just send you for tests.
Let's try this. Yeah. Right. Right.
But I think, yeah, it just really helps on the doctor's end to be
Mm-hmm.
able to pull down a little easier.
Yeah. The education, educating yourself, knowing your body, understanding it, tracking, preparing for the doctor's visit will give you a better outcome. So,
Yeah.
there you go. For those that might not have access to in-person care,
Mhm.
where can we get help? What do we do?
So I mean, I particularly work for a company named Alloy, but there are a lot of telehealth platforms that the beauty is that they provide access
Mm,
uh, to women in remote areas who may not necessarily even have access to uh, a specialist
mhm.
miles, or may have to
Yeah.
travel to a main city. And then when they do travel, they may have to wait like 6 months, for an
Mm,
appointment. So there are telehealth companies like Alloy that offer online virtual consults. And, you are able to be seen within a relatively short period of time. There's a little bit more flexibility in terms of, if you're on your lunch break, so you don't
yeah. Yeah.
travel, you
Right.
kind of
You don't have to take the time off work to
and
see a
yeah,
physician.
yeah,
Right.
you don't have to necessarily
Yeah.
take it off because that can be a barrier, especially for some women of color, right? It's like I've had to do this. I've had to like I can't get breaks, at work. There are other issues that can be a barrier to getting the care that you need.
Yes.
So, there are opportunities to be able to find somebody who can help you sooner and offer you solutions sooner than
That's
having to
good.
wait to be seen.
And oftentimes we don't need a vaginal exam, right? I mean, that's the question that we get all the time. Well, don't I need a vaginal exam if I'm going in to see a physician for? And sometimes that's necessary, but not all the time.
Right.
Not every case,
So
right?
it really depends because again,
Yeah.
if you have painful periods or you're having, there's heavy bleeding,
Yeah.
definitely
Of
need,
course.
an in-person evaluation. But if we're talking about, perimenopause,
Hmm.
PCOS, things where this can be done in conjunction, with
Hmm.
your gynecologist or your PCP. There are specialists when it comes to polycystic ovarian syndrome, or even if you're having PMDD or, perimenopause, where they work alongside so it's not exclusive, but they work
Hmm.
alongside your doctor. So let's say, you consult with one of these specialists, they come up with a treatment plan. A lot of times, if there are any issues that occur, we're still having you go see your gynecologist or, your PCP. So it's not an either or, it's in
Yeah.
conjunction.
It's the whole team.
Yeah,
They always say build your team, have your team, and it's a team of individuals that are helping. Yeah. Thank you for that.
yeah.
We are at the top of the hour, so we don't have time to take questions, but I'm wondering if anyone has additional questions, where they might be able to find you. Where you work with Ally Health, where can they find you?
So www.myalloy.com. I also love to produce educational content, for women in midlife, and I'm at dr.kudzai on Instagram and TikTok. And yeah, and that's where I am at the moment.
That's fantastic. And we have some that are watching this webinar, some that will be listening to it. So that is spelled Kudzai, correct?
Yeah.
Okay, I've got that. Yeah. Well, fantastic. This has been a great conversation. I wish that we actually had 2 hours because I have a lot more questions for you, but maybe we do version 2 or take 2. But thank you so much, Dr. Dombo, for being here and sharing your expertise with everyone. And happy Menstrual Hygiene Day. Thanks for being here with me on this day.
Thank you. It was my pleasure.
Take good care.
Bye-bye.
Thank you for listening to the Medovia Menopause Podcast. If you enjoyed today's show, please give it a thumbs up, subscribe for future episodes, leave a review, and share this episode with a friend. Medovia is out to change the narrative. Learn more at medovia.com. That's MIDOVIA.com.